A world connected by flight paths, defying distance to bridge gaps between continents and people. But planes also made it possible for viruses to travel faster than ever before. That turned a local outbreak into a global pandemic. The airline industry was knocked out of the sky. Around 90% of flights cancelled globally. Some airlines couldn't survive. Things are slowly taking off again, but the future of aviation looks very different. Health screening has become as important as security screening. Social distancing in once crowded airport terminals and on board may be the new normal. But how will the new normal ensure protection from a deadly virus that hasn't gone away?
Welcome to our COVID-19 special on DW News. I'm Monica Jones in Berlin, and the last time I travelled by plane was in March. SARS-CoV-2 had just started to spread in Germany and planes were soon grounded. Well, now restrictions are being lifted and people are slowly taking to the skies again, but is it safe?
Birds chirping at the EU's largest airport, Paris's Charles de Gaulle. An unusual silence where 1,300 flights used to take off and over 200,000 passengers transit each day.
We saw a 98% fall in passenger numbers. Since the lockdown measures began to be eased, we've felt things moving a bit. Last week we had an average of around 10,000 passengers per day, which is about 20% more than the previous week. It's much less than last year, but we see an increase and some movement on the passenger side.
In China, where the pandemic first broke out, the low point was mid-February, with only 23% of the normal flights. That is now stabilized at around 60% compared to the previous year. But the industry fears passenger numbers will never reach the same levels.
Passengers need a good reason to travel at the moment. We expect new measures from the government starting June the 15th. We now have passenger restrictions until that date, and we expect a resumption of flights in the Schengen area on the 15th.
But before that happens, passengers have to feel safe. It would take years to equip aircraft with new seating plans, and may never happen given the air carriers' tight budgets. For the time being, travelers will need to bring a lot more patience with them. In Delhi, baggage is disinfected outside the terminal. All passengers are checked for a temperature. Negative corona tests could be added to the list for passengers boarding in some countries. Seating on this flight is socially distanced. The flight attendants' uniforms are also different.
So experience-wise, to just sum it up, if you ask me, yes, it is overall different because we are not used to coming to work like this.
And the job isn't over once the flight lands. This cleaning team in Delhi has to completely disinfect the aircraft.
So is the coronavirus the kiss of death for air travelling, or can we reduce the risks of catching a dangerous disease? Let's bring in Professor Ashok Srinivasan from the Department of Computer Science at the University of West Florida. Good to have you with us. And I understand that you are the principal investigator of new research on pedestrian dynamics models. And that has recently been used in the analysis of procedures to reduce the risk of disease spread in airplanes. In terms of health, how risky is it to fly?
Well, if you look at one specific flight or one specific individual on a particular flight, the risk of infection is not very high. However, considering that there are so many travelers and so many flights, it's inevitable that sometime or the other there will be a major outbreak on the flights. Similar things happen in SARS also. So most of the flights, no one infected anyone else, but there were a few flights where a lot of people got infected.
So the risk of getting infected on a plane isn't higher than, let's say, on a train or in any room that is closed?
Roughly that's correct. I don't want to give exact numbers because in a new outbreak, it's always very difficult to predict what's going to exactly happen. But because of the large number of flights, you have a high probability of some outbreak or other happening over the whole system.
All right. Well, let's take a closer look at this SARS-CoV-2 virus, because obviously one way to reduce the risk of catching that virus is social distancing. That is pretty impossible on a plane, isn't it?
Social distancing is not a all or nothing thing. It's not like, for example, they are talking about the 6 feet threshold. However, if you are much closer, the probability of infection is much higher. And sometimes you can catch it even if you're farther away. So airlines can do certain things. For example, some airlines are removing the people in the middle seat, so that increases social distancing a bit. If you look at a passenger, they can, when boarding, they can actually try to maintain distance. For example, if you board last, you can try to maintain distance with the previous person, and you have some control over what happens.
Okay, so if everybody boards last, then the plane will never take off, and leaving out the middle seat is obviously not very cost-effective for the airlines. You did a lot of research, certainly in the way that humans behave in sort of narrow passageways, and you used Frontiera, which is one of the world's most powerful supercomputers. How did this computer help you with your simulations, and what were your findings?
Well, one of the observations is that human behavior is very hard to predict. So if you look at one particular simulation or 2-3 simulations and try to see what will humans do, you are probably not going to capture all possibilities. Especially a major infection outbreak and an extreme event. So to capture that, you need to look at all possible ways in which humans actually behave. So to do those simulations, we did millions of simulations. So that takes a lot of computational effort. So that is the reason we had to use a supercomputer, because we want to look at extreme events where some unlikely situation leads to a major infection outbreak.
Now, given that a lot of people are starting to fly again because planes are no longer grounded, you already said it's a good idea to be the last on board. That might not always be possible. Anything else we should bear in mind? Is there a particular safe seat or row, especially when we think of air ventilation and droplets that carry viruses and them floating around?
Theoretical models suggest that sitting in the aisle seat is most dangerous because one is you are close to people who are actually walking in the aisle, and also the air circulation, most of the planes takes the air from the window side into the aisle side. Some planes, it differs, but on the whole, it tends to move the air towards the person on the aisle, which increases the infection probability.
Well,
in the SARS outbreak,
yeah, please go on.
In the SARS outbreak, though, in one of the major outbreaks, actually, it was equally spread between aisle, window, and the middle seat. So it's not guaranteed that if you sit in the aisle, you're going to have a higher probability, and if you're in the window, you'll have a lower probability. However, it has some modeling support and some common sense that window would be a little safer than the aisle.
All right, I know what I book next. Professor Ashok Srinivasan from the Department of Computer Science at the University of West Florida. Thank you so much for your time.
Thanks. You're welcome.
Time for your questions now. Over to our science correspondent, Derek Williams.
When we have a vaccine, how can we provide enough shots to inoculate everyone? Is there a plan to coordinate efforts around the globe?
There are now over 120 different COVID-19 vaccine candidates and studies going on around the world and based on a range of technologies. Some developers are so confident of success that they're already making plans for large-scale production. The most likely scenario is that we'll need more than one successful vaccine to meet global demand. And it could well be that different demographics like children or the elderly respond better or worse to particular vaccines. So the shotgun approach is actually being viewed as a positive thing. In late April, the WHO launched an international initiative called the Access to COVID-19 Tools Accelerator. It's aimed at coordinating global efforts and ensuring equal access to any drugs or vaccines that are developed but several key countries, most notably the US, have not come out in support of it.
Is there a difference between PCR tests and ELISA tests?
A PCR, or polymerase chain reaction test, is a method for multiplying and tagging small amounts of genetic material, like RNA, from a swab sample taken, for example, from your nose or your throat. PCR is the primary method used to determine the presence of SARS-CoV-2, so whether someone has an active COVID-19 infection. ELISA, which stands for Enzyme-Linked Immunosorbent Assay, is what's called a serological test. It's a blood test for detecting antibodies made by your immune system in response to the virus. And they take a while for the body to produce. So PCR tests tell you if you're currently infected, while ELISA tells you if you might have had the disease already at some point in the past.
How come our experience with pandemics like SARS, Ebola and HIV didn't help us stop COVID-19 right away?
Since the SARS epidemic, we've had over 15 years to prepare for another fast-spreading, deadly new respiratory illness caused by a coronavirus. Many experts said over and over that a disease like COVID-19 was inevitable, that it wasn't a question of if it would happen, but when. And what did we do to prepare? Not much. The most you can say is that we didn't have to start completely from scratch, because a few labs did pursue coronavirus research during the last decade and a half, especially after the advent of MERS. But the pharmaceuticals industry largely lost interest, and that's mostly down to the fact that there just isn't a lot of money to be made in preparation or preventive measures.
That's all for our COVID-19 special. Thanks for watching. And before we go, a helpful reminder for those of you planning to board a plane soon again. Be sure to bring wipes with you to disinfect surfaces, plastic zip bags for personal items like your ID card. Wash your hands as often as possible. Stay in your seat and wear a mask. And in either case, have a safe flight. Thanks for watching.